Hi guys, this is Jason Williams, DO. This is the Williams Family Medicine channel helping you to live your best life. In a recent video, I discussed some of the manifestations of type 2 diabetes, or some of the symptoms that you might look for that could indicate that you have type 2 diabetes. One of the viewers asked a more detailed question about expanding on the eye type of disorders that might be seen with diabetes. That's a fair question. Actually, there are quite a few things that I have seen in my patients that are associated with diabetes and eye conditions. In the video, I covered blurry vision because of changes in the eye lens, but there are many other conditions that we have to discuss if we want to be more exhaustive. So this video is a brief video that just goes into the diabetic eye complications from a family doctor's perspective. Keep in mind, I'm not an eye doctor, and these are just things I have seen with some of my patients, so it'll be a brief overview. Blurry vision can occur because of distortion of the lens. The lens helps you to focus any incoming light and make a clear image. If your blood sugar is elevated, then the lens will become distorted in shape and result in blurry vision. This can be corrected with improvement in blood sugar control. If you do have blurry vision and attempt to control your blood sugar, the lens itself may require time to recover and improve. This may take months. So if you're thinking about seeing the eye doctor and getting glasses, you may want to wait a few months while you're controlling your blood sugar before you make a decision about glasses. Another condition that I have seen in my patients related to diabetes is dry eye syndrome. Dry eye syndrome is very annoying. It's a quality of life issue, and it can also cause damage to your eyes if not properly treated. The thought is that you can have inflammation that damages the lacrimal gland, the gland that produces tears, secondary to diabetes. As a result, you do not produce enough tears. It is also felt that diabetes can induce damage to the nerves, probably through blood vessel damage that supply the nerves, that result in decreased tear production. Either way, if you have decreased tear production, the surface of the eye can get dry. This can result in symptoms such as gritty sensation, red eyes, eye discharge, eye pain, and even blurry vision. If this is allowed to progress, you can have scarring of the cornea and persistent vision loss, as well as pain. A few treatments that I'm aware of include using immunosuppressive eye drops, steroid eye drops, and even collagen plugs in the tear ducts. When an eye specialist uses collagen plugs, they're plugging up the tear ducts, causing the tears to stay present longer in the eye. Another condition I see in diabetic patients is cataracts. Cataracts cause glare and cloudy type vision. This is felt to occur because of what are called advanced glycation end products, meaning you have a protein that's linked to a sugar molecule, and these just happen to deposit in the lens, resulting in cloudy discoloration or an opaque discoloration. When cataracts become advanced, they are treated with surgery. The lens is removed and an artificial lens is implanted. Another condition I see in my diabetic patients is glaucoma. Glaucoma is increased eye pressure. The fluid builds up pressure and causes injury to the retinal nerve. It is felt that this is secondary to new blood vessels forming around the iris that are causing sometimes an obstruction to flow of the fluid in the eye. Patients that have glaucoma may experience headache, vision loss, eye pain, halos, blurry vision, or no symptoms. This can be diagnosed by your eye doctor measuring the eye pressure. If glaucoma is diagnosed, eye drops exist that can be used to decrease pressure in your eye and speed up drainage of fluid from your eye. Another condition that my diabetic patients might have is diabetic retinopathy. Retinopathy occurs when you have new blood vessels forming in the eye, in the back of the eye, on the retina surface where your eye is used to focus images. These blood vessels can become frail and weak and can even balloon out or even leak fluid. Unfortunately, some people that have retinopathy can have increased risk for retinal detachment when the retina peels away from the rest of the eye, this can result in sparks or showers or strange visual phenomenon, and can also result in blindness in some patients if not treated. Retinopathy is often treated specifically with lasers in the eye doctor's office. Retinopathy is tricky. If you're a type 2 diabetic, at the time of diagnosis, you may already have diabetic retinopathy, unfortunately. In prior videos, I have talked about how the diagnosis of diabetes is a little bit tricky. You may have elevated blood sugars for 10 plus years before you're officially diagnosed with diabetes. During that whole time period, you could be experiencing vascular damage, which results in these changes. This is also one of the reasons why I try to be more aggressive with detecting type 2 diabetes. Next, I wanted to talk about macular edema. Diabetic patients commonly get macular edema, and it seems to be related to diabetic retinopathy. The macula is a portion of the retina which allows you to see straight on. This gets injured with fluid leakage from diabetic retinopathy type blood vessels, these frail blood vessels that leak fluid. This causes a swelling or edema of the macula portion of the retina. When this occurs, you may see wavy lines, you may have color blindness, you may have distortions, twisted type shapes. This can be treated with steroid injections. This may not be a comprehensive video about all of the eye conditions that are seen in diabetic patients, and as a disclaimer, I am not an eye doctor, I'm a family doctor. These are some of the things that I see in my patients. When you have type 1 or type 2 diabetes, it is very important to see an eye doctor to get regular eye exams. Your eye doctor will guide you on how frequently you need to be seen based on their findings. If you are my patient, you may use this video as supplemental information. If you are not my patient, you need to see your own physician for diagnosis and treatment. This is Jason Williams, DO. This is the Williams Family Medicine Channel, helping you to live your best life. Signing off.